COBD Events Podcast. This week we have a presentation from the Alliance for the Equality of Blind Canadians. They're going to talk about a survey they are running for people living in British Columbia, but that's not all we talk about. So no matter where you're based in Canada, you should find something interesting in this podcast. I hope you enjoy listening.
We hold this meeting on Bowen Island, which in the Squamish Nation is called Nahalahum. We're proud to hold our meeting for you.
Yes, thank you everyone for coming to our session today. We're going to do the questions at the end. We have Chantal talking about the earthquake survey that we're doing, and she's going to explain what's happening. And we'll welcome Chantal today for coming on to our group. We are now.
Okay, sorry about that, Nancy.
Okay.
Chantal is from the Alliance of the Equality of Blind Canadians. Sorry for being busy at the second.
Okay, thank you so much. And Chantal, are you on?
I am, yes. Okay, if everyone is ready. Thank you, Nancy, for inviting me, and thanks everyone for coming this morning. I appreciate that it's being recorded. This way you can pass it on to whoever couldn't be here today. I am here representing the Alliance for Equality of Blind Canadians, the BC affiliate of the Alliance. So that means we had at one point several chapters across British Columbia, but what we've done in the end, we amalgamated all the chapters that were left, and everyone then is welcome to participate no matter where you come from around BC. The topic of our conversation today is actually not just earthquake, it's emergency preparedness. So any kind of emergency. And so what prompted this conversation last year is the fact that Disability Alliance BC offers funding through our government, through one of the government ministries, and they are in charge of giving or making sure that funding goes to as many organizations as possible. And I think there's probably somewhere around $400,000 that they handle every year to be able to disseminate. So what organizations do when the call comes out for funding is we apply for a project that we think would benefit the members of the community, whatever your organization is, and to, sort of move forward one project at a time. It's not meant for research, it's meant for something that you want to do that would readily benefit members. So the Alliance for Equality of Blind Canadians, the BC affiliate, we applied for funding to inform emergency preparedness. Remember last summer when the Rogers outage happened and some of us were stuck without the ability to use our phones for a whole day and some more than one day? You couldn't go to a store and use your debit card or whatever method of payment you had if they were using Rogers Internet, because they had no capability of receiving payment, and so on and so forth. So we got to thinking, is everyone prepared for that kind of, it's not, it could be considered an emergency. What if you needed medication and you don't have cash in your wallet? You only have a debit card that won't work now because there's no internet service and you really need this medication today. What would you do? Are you prepared for an eventuality where you have an alternate method of payment? So that's what prompted the conversation, and we decided that living in BC, we're always looking over our shoulder. Every summer, I live in the Okanagan, where the threat of wildfire is always there. It's already started, from what I understand. And it seems to get worse every year. It doesn't, no matter how many people they have fighting these fires, no matter how much you even prepare, you still end up having to evacuate your home. You don't know how long you're going to be gone for. Is it a month? Is it two? Is it just 1 day, 2 days? So a lot of us when the summer starts or when we notice the weather getting a little nicer, we pack a bag, we pack a suitcase or two and leave them somewhere where when someone knocks on your door and says, you have 10 minutes to get out, they mean it. They don't mean 3 hours, they mean 10 minutes. And there you go and grab your bag and go. So the threat of floods that's already happening in the Okanagan as well, and from around BC, I think Cache Creek is having a hard time with floods at this time. The threat of heat domes, earthquakes, tsunamis, you know, there's just so many things, and they are all documented in our proposals, just in case anyone wonders. So we applied for funding to see if we could teach the blind community, so blind, deafblind, or partially sighted individuals who would be interested. This is, by the way, so you're clear on this, this is not only for members of AEBC. While I would like to encourage anyone who would love to join AEBC, I am not here to ask that you join our organization in order to benefit from what we're about to teach. This is, the funding is made available for everyone to be able to participate in our community. So we are trying to reach as many people as possible who are blind, deafblind, or partially sighted to help us inform the subject of emergency preparedness. Because if you went online today, those of you who are able and or interested, you'll find some information on what to do to prepare for an emergency. They'll tell you what to put in the bag. They'll tell you you can buy a bag with all the stuff in it already. They'll tell you a lot of things that you should write down and you know, keep your insurance papers and make sure you know your doctor's name and phone number and have all of that. Well, as a blind person, there's not a lot of information to help persons who have different needs, you know, and let's face it, as a blind person, we do have different needs. So in order for you to document all that information that you might be able to have access to, it's okay to have it all written on paper, but can you be certain that there'll be someone around you that'll be able to read that to you if you don't have access to a method like Braille or let's say you know, equipment like a Victor Stream that could fit in your purse or in your pocket with an SD card in it with all your information? Can you, so the point is, we didn't find a lot of information that would assist us or that would assist someone else in helping us, because when you're all together in a crowd and there's someone leading the charge and says, we all need to move this way, and as you turn left outside of this building, go west, and it's about 50 meters and you'll be in the right place. As a blind person, you may not be able to follow those directions in the sense where you can make sure you can arrive there safely. So we need to educate also the general public who might be in a position to help us to know what to do. If you have a service dog, if you have a guide dog or something like that, they also need to know what your needs are in order to be able to make things as, you know, as easy as possible. But also the end product will be that you will feel more confident after you've attended the workshops and received all the material in being able to help yourself. And heaven forbid, you should be able to help someone else as well. I mean, you may have in your pack the things that they weren't told about, someone else around you, your neighbors or whatever. You know, for instance, I think backpacks that come complete with all the things that you might need in an emergency come with a flashlight. Well, maybe some of you can't see at all, and that flashlight wouldn't be any good to you, but it might be good to someone else who's trying to help you. So independence is actually a little bit of what we're after, to inform the general public as to the needs that we might have that are different than a person who is able-bodied and doesn't have a vision impairment or hearing problem. And we also have promised in our proposal that once we are all done, we will put all our resources online, all our research And this research will have been informed by people like you as to the things that you think you might need or things that you'd like to see happen in the event of any emergency. So the proposal contained a few things that we were going to do, and now we've started the project, and this is where we're at. We have launched a survey that we would appreciate every person in BC who is blind, deafblind, or partially sighted. And when I say deafblind, if you are someone who has some sight loss and some hearing loss, then that kind of puts you in that category of being able to participate. And if you're not sure of something, you definitely could get in touch with the appropriate person who has been listed on the survey. But what we're trying to do is to get as many people as possible to complete this survey, if you wouldn't mind helping us out. And with that, we will receive the information that you would like to learn about. There will be workshops held, I suspect, late October, towards late October. We'll be inviting anyone who had indicated in the survey that they complete, definitely that the workshops will be happening. We will also be putting out another call. I mean, if you didn't get a chance to complete the survey, or you decided at the time this wasn't for you, but come the fall, you realize, hey, why not? Why can't I go and learn? We'll put out a call to make sure that people can register if they wish. Our aim was to have, 30 to 40 participants who would come and take the workshops. And the idea is that you stay from beginning to end. You would, I'm assuming this will all be done in one, just a one workshop thing. I'm not sure exactly how long it would be. We've hired a project manager whose job it is to create the plan, to create the whole, from the beginning of the project to the end. She is the one who is assessing what she needs to do in order to complete and fulfill the needs of that proposal. So you come to the workshop, you learn about emergency preparedness. Our goal is that you will formulate a plan of your own. Everyone will have their own personal plan by the time they hopefully leave the workshop, or at least have an idea what that personal plan might contain. And we will also provide you with a kit, which will be, I understand I think it's a backpack, it's a bag of some sort, but my understanding, what we looked at, and we still have to make those arrangements, but you will receive a complete bag full of everything you might need in the event of an emergency. Whatever's in that bag, we will make sure that it is adapted to the person receiving it. So if you were someone who would require a little bit more large print information, if there was any information in there that was printed, we would do that for you. If you were someone who would prefer having it as an audio format, we would do that, or Braille, same thing. We would make sure that the bag is tailored to you before it comes to your home. So we are excited in that the survey has been launched for about a couple of weeks now. So far, we've had around 70 responses, and the more we can get, the better we can inform the subject of emergency preparedness for persons who are blind, deafblind, or partially sighted. The province has put a lot of money into emergency preparedness lately as well, from what I'm hearing. We're depending on other resources to, kind of gather the information that fits us, and we're sharing with others as well. So if you know someone else who's doing something along the same line and you'd like to put us in touch with one another, I know that there's another project going on in Port Hardy that DABC gave money to. I think it's a Sacred Wolf Friendship Center that's doing an emergency preparedness for persons with disabilities. Now they're talking about all disabilities, so mobility impaired and whatever else happens in their community. So, at some point we're bound to cross paths. And it just seemed to us like a lot of times people think about, well, how would a person in a wheelchair get here? Or they think about, helping someone who can fill out a form on their own and be able to, when you go to collect benefits from the province in the event of an emergency, are they equipped to help us make sure that the transition between leaving my home and getting to a center where there's help from the province to get, emergency vouchers for food or lodging or something like that. Often when we get there, blind people, we have a hard time because they're not prepared for a few of us to come and say, we need help completing these applications or doing any of that. And that's what we're trying to avoid. We want to make sure that we fit in not only as an afterthought, but we want to make sure that we have everyone as prepared as we can possibly be to be able to confidently make sure that we are safe and that we can deal with whatever the emergency is. It's never going to be perfect, and I can assure you that even hearing from other professionals like firefighters or police or any first responders, they don't have all the answers either, because chances are they may not have had the experience of having to guide a blind person or a person with a guide dog to safety in a way that you won't be upset or alarmed or a little bit scared maybe, or I always wonder sometimes when if I go somewhere with someone and it's particularly dark, I have some vision, and some people think that the best way to lead you around is to push you ahead of them. And that doesn't work for me. I always think that, so if there's stairs and you forgot to tell me, I'll be down at the bottom while you're still standing at the top. And so, learning proper guiding methods, it's very simple to us. We've been hearing it forever, but some of those people, and especially in a frantic situation, they haven't got a clue. And also for any of you who think that maybe, and hopefully, some of us have made gestures towards this, but can you be certain that your neighbor would come and help you if there was a fire? I'm not too sure I can say that. I think I have to say probably not, because on any nice sunny day when I go to their door and say, hey, if there was ever a fire around here or a flood or we had to get out in a hurry, could you make sure you knock at my door and make sure that I've left the building? They might say yes, but in a panic, I'm not too sure I can trust that they would do that. So I have to be able to know that I can do this on my own somehow. So I think I'll stop here, and I welcome any questions, and I'll tell you how you can get the information once we're done with questions.
I just want to bring up one observation.
Sure.
Talking about people who don't know how to help the blind. Mm-hmm. I'm in the presence of caregivers that come to me twice a day. And I spoke to their supervisor. They get no specialized training in how to help the visually impaired.
I believe that.
And I'm trying to I've talked to the supervisor. I said, well, why? I said, it's a simple procedure. You get somebody that's visually impaired in to instruct them on how to do it. But they won't. And I'm under VHA care. And like I said, none of the caregivers get specialized care.
When you say they won't, have they said no, or they just don't know where to go to ask for the help?
They actually said no. Because they figure it's up to us to inform them.
But if a different person comes 7 times a week, that's 7 times you haven't got the proper care or the proper way of giving you care, because you've got to.
Yes.
You've got to teach. Wouldn't it be easier to teach them all in one room?
That's what I've said. I said, wouldn't it be?
Is this private
teach them all
care?
in one room by one person. Pardon?
Yeah. Is this private care or is it affiliated with the health authority?
Affiliate with the health.
Then that's
I'm
totally
in what they
wrong
call a
on their part.
specialized building. Yeah.
Right. Then to me, that's totally wrong. Can I just ask what area you live in? I'm just wondering.
I'm in Victoria, downtown
You're
Victoria.
in Victoria. And I think that if our health minister heard this, he'd be ashamed. Because AEBC has had the ear of the health, the Ministry of Health office. We haven't actually spoken with Adrian Dix. We've spoken with someone representing him.
Yeah.
And letting them know that the way they provide services to blind people is often very atrocious. How many times have you gone to a doctor, whether it's a specialist, and they're explaining to you about your condition, and oh, by the way, Mrs. Smith, here's a brochure on how you can inform yourself further.
Yeah.
It's all in print. Never do they tell you, if you have access to a computer, you can go on this website, or do you need help reading this to you? Can we provide it to you in an alternate format? You know, if the simple people like us can provide things in alternate format, surely government is equipped to do the same. And we know they are. So thank you for bringing that to my attention again, because that is one of the things that we have already spoken to them about. They have agreed to speak with us again. We have written back for a second meeting. And of course, at the time we sent our next letter, government changed. And although Adrian Dix is still in the same office, same ministry, you know how it is. It takes time to get that second commitment where they really are on the hook for something that we're saying to them.
They pass the buck.
Sure, they do.
The buck.
Yeah. So that's a very interesting point. And, you know,
I've got another one.
Yeah. Okay.
How about when you go with a caregiver, some people look at the person, and then they want the staff and they look at the staff and they want the staff to do the talking for you. That I despise.
Yes. If you're capable of living on your own or speaking for yourself, there is no reason for someone else to be speaking on your behalf. And
that's what they do. When I go with somebody out my home, from my home, they will look at the staff and try to get them to do that. And I went
to talk for us, and that's not right.
I went to an appointment. I went to an appointment, and it was an eye specialist. He was looking at the caregiver and asking her these questions.
Did you say something to him or her?
I said, look, I may be blind, but I can hear. I can speak for myself.
Yeah.
And I've done this more than once.
Yeah.
And this is where
it happens all the time.
I think it's an automatic reaction for them. You know why? I think the eye contact, for one thing. So many people,
we're blind, we have no brain.
Well,
that's right.
People who can see, though, operate definitely under the assumption that the only way they can get someone's attention is by making eye contact. And we can't do that. So they figure we're not listening. They figure we're not, paying attention.
Able to speak.
That's also, educating our doctors, our nurses, when we had a chapter in Kelowna, we used to have a group of volunteers. We would go and actually we did a few sessions. One of them I remember was in a group of, the people who volunteer in the hospitals to take you from point A to point B. Ambassadors. Okay, thank you. Well, we spoke with them and offered a little bit of training. And I think that was good for a while, but, they turn over and then new people come along. And so one day I went to the hospital for a test. I had to do some kind of x-ray thing that required injection of dye or something. Anyway, the procedure had changed. Normally, I would go up to the desk, present my care card, and the person at that desk would deal with what they had to do, tell me, give me my card back, tell me to go sit down, and that was it. Well, when I got to the lineup where people were standing, I was also with my husband, who was totally blind, and so he decided that he was going to manhandle me, pulled on my arm to try and get me to go to sit down. Then he wanted me to give him my card so that he could do my business. He was going to go give that to the receptionist and see, if she could fill out whatever paperwork. And then you go to the volunteer sitting at the table and they pull you through to go get your x-ray. Well, I'm afraid I was less than generous with my being polite that day. I yelled really loud. I don't like being manhandled. Someone all of a sudden is pulling me. All he had to say is, if you'd like to sit down, I can do this for you, or our procedures have changed and I'm to take your card now. I'll process this, and when it's time for you to be called, they'll give you your card back. But no, I found out later this was someone who had served in the military, and you know what? After all was said and done, I found out also that he was aggressive with patients. Maybe it was his training, the way he was used to doing things, and I don't really care about any of that. Whatever your history is, you should have been taught more sensitivity. No, don't. You should have been taught more sensitivity. So, those things are happening, and we real. Sorry, go ahead.
And some of the handy dart drivers or cab drivers will drag you like your dogs.
Yeah, I know that. You know what? The whole world needs a whole lot of sensitivity training. To make sure that we are treated appropriately and more on an equal basis as the rest of the community. But
we've educated ourselves to be blind, but we have to educate others how to act to blindness. It's a whole new world for me when I went blind.
Absolutely. Yep. I can imagine.
So to them, they don't know. When you have a broken leg, they can see what they can do for you. If you have a broken arm, they can know what to do. But when you're blind, they don't know how to work with it.
No, we often get.
And I've always said we have to educate the others as well as educate ourselves
on how to do it.
But unfortunately, a lot of them are not receptive to learning because they don't think they have anything to learn. So I'll
say to them, well, what are you going to be like in 20 years? Maybe you should learn now in case you go blind.
Well, anyone could lose their sight for different reasons. Yep. Anyone could lose their sight or their hearing for different reasons. There's no discrimination there. It can happen to anyone. And, so.
Oh, yeah, it can because, you can have sight one day and not have sight another day because that happened to me. And, it's what gets me is when I go to places and, they'll say, oh, can you sign that? And it's like, well, yeah, you have to put my hand where I need to sign it. But, I can sign. Oh, yeah, they think blind people can't sign their own things or do anything themselves. But like I say, I'm in an organization. I work for an organization that we even got to teach others as well as what, because I'm not working with just one disability. I'm working with them all. But blindness, they just see, and what gets me is, even though you're blind, they also think you're deaf, so they start yelling at you.
They're yelling at you, yeah.
Or you can't walk either.
There you go.
Yeah.
I've been through earthquakes, and I've been through fires, floods, and hurricanes, and being the way I'm today, I said to everyone, let me help you guys out. And when we had that big earthquake in California, I know there were seniors, I know there were disability, but I was disability too. And you know what? After 2 weeks and all the all that, after the shocks and everything else, I got everyone together with their community and got all the food out of the house and bought a potluck. And without me there, they would have been lost and I was blind too. And we had to work with each other. And when it came to a power out for 78 hours, I was prepared because I knew what to do. And I went to Maywood School and made an earthquake kit and everything else. These are things that we need to initialize, because one day we are going to be either a disaster of a fire or earthquake or floods, or who knows what's going to happen, and a hurricane. And what Chantal is showing today, I think this is the best idea, because that was one of the topics that I really wanted to focus on, and us being prepared for all this to happen, if it does happen, with our disability or not disability. We're trying to help each other out from today and forever, because we can do everything else like everyone else, right?
And everybody, even though they don't know it, the sighted people, they've got a disability as well. They don't think
Thank you.
but they do.
They don't show it. Yes, that's right.
Yeah.
I want to try and stay on topic, but all of this is also very important, because in the event of an emergency, if the person who's trying to help you hasn't got a clue, you need to be able to be assertive enough to say, these are the things I need you to do, or, with this help, I will be able to do this, this, and this. And so all of this is very important, and I would encourage you to keep exploring. And, I'm sure that at some point we can all try to help one another to see how far we can get with educating the people in the health system, the people who, these doctors that have studied for 15 years before they could operate on a patient, or even, be some sort of person who could advise you on your health. They have forgotten about the bedside manner. They have forgotten about the person that they're treating isn't just a number on a chart, with a health number. For myself, when I speak of a doctor or a physician, I have a wonderful physician who would never speak a word out of turn if he possibly could help it. And if he did, he'd be deeply embarrassed and apologetic. But I've also met other doctors who aren't that way, and they just don't care. They have their own itinerary, their own schedules, and they don't have any idea how you got there today, how you're going to get home if you're upset, or if you have to go for another test, or you've received bad news. They haven't got a clue how all of that's going to happen, nor do they think it's any of their concern. So there's a lot of work to do in this area, and I don't deny that. There's definitely things that we should revisit here that we've talked about today. But if we can start.
One thing I noticed, Chantal, that when I'm in a condo and I'm deaf and blind, and I don't hear the fire alarm outside when there's a fire. So right away, the paramedic they come to my doorstep and I'm knocking on my door. It's a fire, it's a fire. And you know what? It makes me feel comfortable that I'm in a safe environment. And then I give them a list of who emergency calls. I have an earthquake kit that I try to put up every 6 months because they expire. But the whole idea is try to reach out to your friends, and anything ever happen, they have my contact and they can phone. Instead of like I got broken into the window, someone phoned my dad in Victoria and I was on holiday, but I forgot to give my contact. So right there, I knew I started giving out my contact. Even if I'm traveling, they got my passport. If a disaster happened in Mexico or something, they know that I'm on this plane, that I'm going to be safe coming back because I'm over there. It's just an open eye for everyone. And like I said, thank you, Chantal, for coming on. You made, go ahead.
When I travel, just I have a daughter who lives in North Vancouver, and I'm in Kelowna. So when I travel from home to the mainland, there are 3 people I always notify. I'm on the bus, or I keep in touch with where the bus is held up or whatever. So my 2 daughters and I have 1 special friend, and even though we don't see each other that often, they are a family who I befriended 36 years ago, and we've always stayed friends. And so somebody has
that's
an
good.
idea
That
that
is
I
so.
went on a bus today, and somebody has an
Yeah,
idea
yeah.
that, I should have been there 10 hours ago, but where am I? And, my kids, I know they're my kids, they should be worried, but trust me, I know a lot of people who have kids who wouldn't have a clue their parents were on a bus. So
Yeah, that's
it's good practice sometimes to share with someone that you have plans to do something different than what you do
There you
every
go.
day.
Different.
Yeah. So if
Um,
if if any
hello,
of
this is
you,
Bill.
Well, okay, what Bill? Want to answer the question? Go ahead. Oh, happy birthday,
Uh,
Bill! Today's Bill's birthday. He's 26
yeah,
years old.
okay.
Okay, go ahead, Bill.
Okay.
Happy birthday.
Thank you.
Okay.
I'll say my quick piece, and I got a scoot. But anyways, I do a lot of travel myself. So what I do is I turn on my iPhone locator, and I have a few friends I send the link to, and they can track me anywhere in the world.
Yep.
And
Excellent.
yeah, and that plus I have connection with them on WhatsApp and other communication platforms. So every so often I update them as to where I'm at, where I'm going, so then they can track me. They in fact track me 30,000 feet up in the air on the airplane as well.
But a lot of people can't afford iPhones.
That's
you don't need the iPhone because the cheaper phones, there are apps that will allow you to send a link to other people. Yeah, so you don't really need an iPhone. It's just the mechanism.
No, but you do need a cell phone of some kind. Because I only have a landline.
Yeah, a lot of people still don't have technology, and that's okay. There are other ways, but if you do have technology, I'd suggest you do like Bill, learn how to use it to your advantage because it works. But if you don't have access to that, then we have to think of other ways outside the box that will end up helping out, right? I see a few people on the phone here today, which means you're either using a landline, there's a few of you. It's, we have to think of all types of conditions, all types of circumstances. Just because some of us manage well one way doesn't mean that works for everyone. And so, we need to be cognizant of that. Last week, someone in our organization helped one person complete a survey who does not use a computer. There's no email to contact. There's no, so the only way she can be contacted is by phone, and that's fine. That's not a problem. We're still able to make sure that we stay in touch. So what I'd like to mention now is if any of you are, and I hope you will take the time to complete the survey. It won't take, it doesn't, it kind of depends on your level of ability to use the computer to complete the survey. If you are, it would take 10 to 20 minutes, we figure. If you are unable to use a computer to complete your survey, you can let Nancy know to contact me, and I will either A, help you, B, I will find someone. We have a few people that have volunteered to help anyone who has a little difficulty or would like some assistance completing the survey. It won't take long, but I assure you it will be of the most benefit to the people around you and yourself, hopefully. And hopefully you'll be interested in joining us for a workshop. And if you can't participate now, then maybe later when we call out again, we'll make sure that Nancy lets you know that it's actually happening. The workshops are ready, and it's a little bit of time out of our lives to try and learn from each other. I'm really not pleased to hear some of what I've heard today that is happening for people who need care. I'm 62 years old. Someday I might need care. My kids have promised me that they won't shove me away in a home if they don't have to. We've seen beautiful, some of those homes are beautiful. Some of them are not as well equipped and not as well staffed to guarantee that your mother would be well cared for, so they're pretty apprehensive about that kind of thing. But if I ever do need care someday, I sure hope that we have brought society to a point where they can be a little more sensitive to our needs and proactive in actually wanting to learn what's best to do for us and not treat us like we don't matter. So yeah, I hope that that's, some of this has made an impression for you. And I am definitely, the BC affiliate is definitely interested in furthering the conversation of our health system being able to do better as to how they treat people who are blind, deafblind, partially sighted.
Awesome. I just want to put in here that you can get the survey on the cobd.ca website, or you can ask me or Nancy for it, and we'll be glad to give it to you.
So you've got the
And
survey
remember,
already on
there's-
your website, right?
Yeah,
Yeah,
it's
we
on
have
the
it ready.
on the
Yep,
post.
we have it already.
It's on the post
Yeah.
talking
Thank
about
you.
it. Yeah.
That's great. Thank
And
you
then
so
plus, don't
much.
forget, there's a door prize. There's I think there's that prize or was it a gift card or gift certificate?
There are five $100 incentives to complete the survey.
Good luck, you guys.
The gift
Yeah.
cards will be to places such as where you can buy groceries or supplies. The idea, the thought process behind that was that, if someone said, well, now I have a kit, but I don't have the money to put, food in it or other supplies that I might need, even though it's going to come equipped with a lot of things, but, your own food. While the idea is that if you won that prize, it would be nice. And I mean, beyond the fact that I've given you the card and you've won it, I'm not going to worry about what you did with it, but it won't be to go out for coffee. It'll be to buy groceries or supplies.
No.
You know what I mean? It was just the idea
yeah.
to help out. Yeah. And there'll be a draw for 5 of those cards. Yeah.
And there's a workshop too, I saw, and people can join for that workshop too, because I love to join up and help people out, because I'm one of those people that like to get involved, and this is how we help each other out and send it to everyone that even with the disability that they need help. And this is giving us an opportunity. Like I said, Linda, I can call you Linda, Chantal, I really appreciate what you have come on today to share this opportunity for us to learn things, right? I mean, this is an open eye for everyone.
At the bottom of the survey, it will ask you if you are someone who may wish to participate in the workshop. All we ask for is your email address. That way we can contact you. And that's the place where I said, if you don't have the use of a computer and someone is helping you to complete the survey, just give us your name and your phone number. That's how we'll be able to get in touch with you. Okay?
Well, that is so wonderful. Thank you.
To enter the draw for the prizes, you will also need to put your email address. So there's 2 different questions at the bottom of the survey. Do you want to enter the draw? Put your email address here. Do you want to be contacted for a workshop? Put your email address or your information there. And otherwise, the survey was meant to be anonymous, but we can't have you be anonymous if you wish to enter a draw, unfortunately. So you have to decide what's important to you here. Yeah. Go ahead.
Chantal, I'm from New Brunswick. My name is Patty, and I'm from St. John, New Brunswick, East Coast, Canada. Now, I know, so are these workshops online, or are they in person?
Okay, so first of all, one thing to be very important to remember, and I have no idea who's online and where you're all from here today, but this project was aimed at persons from British Columbia only, so you should reside in British Columbia. It's not because we don't want other participants, and I'm hoping that this project will work out so well that we'll be able to find funding to do for the rest. We could have like a national AEBC project like this, so anyone from across the country could attend. What we'll be doing is everything is going to be virtual. It's all going to be on Zoom. And as I said, we are not meaning to exclude anyone from outside of BC. It's that we are responding to the funding that was given to us. And, if we get people from outside of BC completing our survey, that would certainly skew our results. We are wanting to report back to government and say, you know what, we had 500 people who answered this survey, and out of those 500 people, 435 of them told us that they had no idea how to help themselves in an emergency, nor do they feel confident that they'll receive the help they need if, you know, someone was to come and help them. They won't know how. So we are reporting back to government for sure the results of everything that we do. Government likes numbers. We all know that. They like statistics, and they like to know their money was well spent. And so, you know, our goal for this project is to make sure that they get enough information to realize that this is important, and that we may, you know, hopefully maybe we'll need to run it more than once to make sure that, you know, people have the opportunity
and even if
to
it's
learn
in
what
her
they need to
community
learn.
too. Yeah. Yeah, and even
Yeah.
though it's in her community, she can share this to, like, get it started where she even just start, and then start getting, apply for something like what Chantal
Like
did,
what we did.
and then we
Yeah.
help them out too. Yeah,
The
and
bulk of
then
the
start
money,
something, Patty.
the bulk of the money we applied
What's
for,
that?
Patty, what we're suggesting is that, you know what, if even if you're just a participant, as in, and you're listening and you're receiving the information, maybe something you want to start in your area where you live.
That's what
And
I'm saying. Yeah,
the
open
bulk of
doors to everyone.
you know, we're hoping that,
Oh yeah, no,
I'm
it sounds
hoping,
good. It sounds interesting.
I'm really hoping
like
that
I say, I work for the government.
I'm hoping that at the end of the
So,
day,
yeah.
we can do a national project whereby we
Well,
will
yeah, I'd
find
like
the
to do that.
funding. And you know, once
Yeah.
we've done some of this research, and we've done, it won't be a costly operation then, because we've already spent the money to hire someone to do a lot of this. It'll be sort of, now we have all the tools we need. We just need to teach it. You know, so the funding we would have to find wouldn't be so high, because, you know, you need to hire someone to pull the project together and to see it through, but it won't be a major operation like it was the first time. Once you've got the tools, you just need to use them in different places, and it will apply for everyone. So we'll keep you guys updated as to how the project goes along.
Robin and Jill, is there any questions you would like to ask right now, Robin? Jill, are they? I thought I heard Robin. Maybe not. Okay.
Sorry, we were on mute.
That's okay.
Oh, sorry. Is there, like, I know you guys haven't answered any questions. The question I was wondering, if everyone had been prepared, does everyone have things ready for an earthquake or any disaster? And that's what I wanted to ask at the beginning, but because I was supposed to be leaving any minute, I'm waiting for my ride. But these are the questions that, you know, you can ask. Sorry about that. Chantal is here to answer any question, and please let her know what, you know, how you feel, and if you're ready, or do you have anything ready and prepared, or I'm prepared.
All of those questions are in the survey, Nancy. All of those questions will be asked.
Oh, there you go.
And then this is how we'll find out what it is you want to learn about. There's even one question that asks about the different disasters you'd like to learn about. So if you know, 65 people say they want to learn about tsunamis and earthquakes, then we'll make sure that some of that goes into the workshop. But if there's not much interest in avalanche, then we'll leave that one alone for now, because there were many topics that we covered. So I think the survey, you'll find, asks pretty much all the questions that are important to this project.
And I got help filling out mine, and mine's already in. And go ahead. The expiry date is end of this month?
Yeah, May 31st. You have until May 31st to complete the survey.
Okay.
And I will definitely send this out to everyone.
I'm sorry, someone wanted to ask a question.
Because I haven't,
I didn't hear what she said.
Because of my work, I check my emails all the time. I had to. I work with an organization. Well, we don't have very many blind, but we have like a lot of wheelchairs and a lot of walkers and stuff like that. So yeah, I think this would be interesting. Just not just like, for blind, but also for other disabilities.
Oh, any
well.
disability, yeah.
No, hold on a second. The information you learn about is good for anyone with a disability, but just remember, we need to keep the integrity of this project intact, and our proposal only asks that we teach people who are blind, deafblind, and partially sighted throughout this project. So this is not to say that someone who is blind couldn't be in a wheelchair. They would be entitled to participate.
Yeah.
We haven't mentioned a lot about other disabilities in the survey, just because the attraction is blindness, obviously, blind, deafblind, partially sighted. But I know that during the workshop, the person actually who we hired as a manager has another disability other than blindness. So she is very interested in talking about what if you have another disability or two. So during the workshop, there will be some information that will concentrate on that. And like I said, there are other areas in the province. In Port Hardy is the one that they're doing emergency preparedness as well, concentrating on, I think, other disabilities. I know the seniors in Maple Ridge are still, this is their second year. They got the funding last year to start this, but theirs concentrates on seniors with all disabilities. So that might be somewhere else, that you can get information from. I mean, whether you live in Maple Ridge or in Victoria, the same education applies, right? In my opinion, anyway, what you can do in Maple Ridge, you should be able to do in Victoria. So, we have to pay attention to the restrictions of our proposal. And quite frankly, we decided to do this only for blind, deafblind, partially sighted, because that's the organization we belong to. I've been visually impaired all my life. That's what I know. I have no authority on other disabilities because I don't have one. And so we're teaching about what we know, but this doesn't mean that it couldn't be expanded, providing we could get further funding to do this. So, and there are other organizations who are much better equipped to inform on other disabilities than AEBC.
No, I understand, and I agree with you, and I know where you're coming through, and when you do apply for different funding or whatever, you had to focus on what disability you're going for, because like I say, I mean, I haven't been blind all my life, so when I became blind, of course, it was scary. I was afraid. I didn't know what to do, and things like that. But of course, we have people. Well, we did have the CNIB here in St. John, but of course, we don't have it since COVID. It's dropped, and now our nearest one, of course, is in Fredericton. But yeah, no, I understand, because we go for grants and that all the time, and you got to just use one specific disability.
Yeah. You have to abide by the agreement, the contract that you've signed. And like I said, I'm really hoping this will work out well, and that we can use all the tools and build on them. Just like when you take first aid courses or first responder courses, the protocols change every few years. You learn how to do it this way today. 3 years from now, they'll say, no, you should do it this way. And so it's always an education. You always need to keep up to what's going on, right?
Yeah. And, I worked at Superstore, and for 25 years, our first healthy kit, every year I was like, someone taught me that differently. And I go, oh my God, it's best to do it every year, and through safety and everything, like even emergency. And we had to do drills. And that was the wonderful thing about this at our job at Superstore. But like I said, now I don't hear it very much. And this is an opportunity for us to open our eyes and realize what's happening. And like I said, Chantal, thank you so much for you coming on today and helping us out and realizing, this is a need, and hope we can do, a lot of people can help each other. I'm willing to bring this to everyone and share all the information that you said today and send it to everyone. And, it's an open door for everyone that are the application form to be done by end of the month, the survey.
Yep.
And hope we can get you to come back and tell us what happened and, keep up to date for everything that we got involved. And, this is great. This is an opportunity.
Yep.
Like, I got to get going. But just to let you guys know, next in 2 weeks, we have a humanware coming on, Michelle, and that will be on the end of the month. And I'm going to get going because my ride is here. You guys continue on. And like I said, Chantal, thank you.
I actually have to
everyone
attend
for
another
coming on to
meeting as
hearing
well. Thank you so
Okay.
much for
Like I
inviting me.
said-
I appreciate it, and I will keep in touch.
Okay, thank you,
Yeah, thanks for
Chantal.
coming.
Sounds good.
Thank
Yeah,
Thank
you.
you, Chantal.
I got,
You're welcome.